My name's Katrina Murphy. I'm a neurosurgeon. I do surgery on the brain and spine, and I practice here at Henrico Doctors Hospital. Very often we see patients who have difficulty with their necks or their low backs. Those are the most common areas of the spine that people tend to have pain or discomfort. Sometimes we can treat them conservatively with things like physical therapy or recommend injections, but other times they need surgery. So what I tell my patients is that surgery is only helpful in addressing pain when there's something that needs to be structurally fixed, because that's what surgery does, is we fix something that's out of place. And so, for example, in the neck, if there's a herniated disc that's pinching a nerve, we can remove the disc from that nerve. Or if there's a bone that's out of place, sometimes we can fuse it into place. Same thing in the low back. We take care of discs that are pressing against nerves. We take care of nerves that have compression from bones and osteophytes. And then we also do fusions to fix things that are out of place. So so we have a variety of procedures that we do, depending on what the indication is. We tend to try to do surgeries that are as minimally invasive as possible. We find that people have the best recovery from those. People are very often surprised that many of the spine surgeries we do, they can go home in the very same day or the following day. Most of our spine surgeries, you don't have to stay several days. The recovery time's usually only 6 weeks, but it's 6 weeks where people feel pretty good afterwards, so it's not as invasive as sometimes people think. The recovery period, usually, even though I tell my patients it's 6 weeks, usually they can return to their normal activities at the end of 6 weeks, sometimes as soon as a couple weeks, depending on what type of surgery they needed. Usually I ask them about how limited they are by the symptoms they're experiencing, and then we look at their imaging together and try to decide if it's going to be best treated with conservative measures or if there's something that may be treated with surgery. Not all pain is treated with surgery, but for those instances where I think surgery is going to be a good option, I do encourage my patients to explore all conservative options before surgery, just so that they felt that they've tried everything but surgery if that's what they're interested in. We're very fortunate here to have a number of very qualified neurosurgeons who work very well together as a team. And so, for example, with my colleagues, we frequently will ask each other's opinions on the best ways to approach different surgeries if there's something complex. If it looks like it's going to be a larger surgery, perhaps a tumor that needs to be removed from the spine, we very often will assist each other. I feel that we have a great group of providers regarding removal of tumors to provide care both during the surgery and after the surgery. Well, I think that we are becoming better and better at determining which patients will benefit from spine surgery and which ones won't. And so I think we've become very good at determining that. I think we're also good at using the least invasive procedures to treat their either cervical disease or lumbar disease, and that usually provides the best outcomes. We also have good advancements as far as treating intracranial disease. We have better modalities of treating that, such as the IMRI that we use here intraoperatively, as well as the Gamma knife for treating tumors after surgery.